Hi, how's everybody doing today? I'm your host, Rich, here on behalf of Rich TV Live with our very special guest, the CEO of Skylight Health Group, Prad Sekar. How you doing today, Prad?
I'm doing great. Thanks for having me.
Hey, thank you for joining us. Super excited to interview you today and learn more about your company. And our community has already been winning with Skylight Health Group. And we're really, really excited about some of the news that you guys just put out today. And we're going to talk about it and get into more detail. So why don't we just get started and you can tell us a little bit about Skylight Health and how you got involved.
Okay, yeah, absolutely. So Skylight Health, we are a US-focused multi-state operator of what we call multidisciplinary health centers. And basically what that is we have medical practices. These are physical clinics that are staffed by doctors and specialists. And the goal here is to provide really patients with a one-stop shop approach to healthcare and the ability to get as many of their outpatient healthcare needs available in one place, because then they know who they're going to. Their physicians share records with each other. It's collaborative. It feels like a team approach to healthcare. And for patients, ultimately, has studies have shown that this type of approach ultimately creates better patient outcomes, keeps people healthier, keeps them out of emergency rooms, and creates really that team to focus on each patient and a treatment plan, as opposed to just kind of saying, come here for this, go there for that, go there for something else. So what we've built now is this multi-state platform. We've got over 30 clinics now. We just announced our soon to entry into our 15th state now. So we'll be soon across 15 states in the US. We'll soon to have over 130,000 patients now under our roster. We're just getting started. We want to get to 1 million and more. And, we're building a really solid platform here. And it's not just about the physical clinics. We also own our own electronic health record. Basically, it's the system we use in our clinics to register, chart, treat our patients. But because it's in-house and we develop it and maintain it, it gives us this unique opportunity to innovate on it as well. And so we've built tools like a patient portal where patients can log in remotely from home and look at their results and book appointments and communicate with the clinic. They use it for telemedicine, which has been great over the last 6 months, because now they can reduce exposure and be safe at home or wherever they are and still have access to their entire Skylight team. And then we're always finding new ways to use technology to combine with our clinics to be able to help our patients get better. And our model for Skylight is really disrupting the way the US healthcare landscape is evolving into. It's a highly fragmented market. You're either a small one-time kind of clinic model, or you're part of this large health network, which oftentimes results in this sort of impersonal approach to healthcare where people don't really know who you are. Your doctor is one of 100 in a big building, and really that's for a community physician who practices patient care. That's really not the best way to treat your patient. And so we believe with Skylight, we're sort of bringing healthcare back to the way it used to be, with a focus on the patient, but using technology and innovative methods to ultimately help patients get better. And we're really excited about this. And we got into this because this is what we've been doing since the last 25 years. My co-founder and I, Cash, have spent the last 25 years running, operating, owning medical practices. And we've done so in both the Canadian market and the US market. We're 100% focused now on the US because it presents a much broader opportunity for growth, and economically is also much better for the business. And so we have a long way to go. We're just scratching the surface, and we're just so excited to be able to keep building on what seems to be a working and trusted and proven business model that we've done for many years prior.
When I started researching your company, I was really impressed. I love what I saw with your company. Some incredible things happening that were really impressive for me. For example, your share structure, your management team, your growth strategy, everything that I was looking for in a company, I saw, and I was really, really impressed. Now, what I want to hear from you directly as the CEO, what are your main focuses? Because you guys have a lot going on. What are your 3 main focuses of Skylight Health?
So I can distill it down. It's true. We have a lot going on. We're an innovative team. We're always doing new R&D projects, but we really have one focus. And our one focus right now is market share in the $1 trillion US healthcare industry. We believe that to reach our potential of $1 billion in revenue, it's not impossible. We need 1 million patients with an average income of $1,000 per year, and given insurable services, sort of your minimum should be $1,000 a year, and some companies do $12,000 a year per patient. We see that as a very near realistic goal to be able to achieve. So we have one focus: deliver quality, affordable, and accessible healthcare to patients in the US under the multidisciplinary Skylight Health model. In that, we have a few different approaches. We do it organically through our clinics. We do it through insurable services. We do it through disrupting the uninsured market, where nearly 40 million Americans today don't have access to healthcare, and we have a unique subscription program for $200 a year. That's one of the lowest priced products in the market today. And then we do it by way of acquisition, by being able to find really attractive deal flow with established patients and profitable and revenue generating clinics at multiples that are usually 3 to 7 times EBITDA or less than 1 times revenue. And it's a really easy way for us to bolt on access to new markets, layer on patient growth, generate those synergies between the clinics. So while we have different focuses under the healthcare services sector, we really are focused on that one category of delivery, which is healthcare services under an insurable fee-for-service model to Americans.
I love the subscription model. Obviously, we can look at Netflix. Everybody pays a Netflix bill of $12 a month or whatever it is all over the world, and we're talking about a $500 stock. Why? Because they got a monthly reoccurring revenue that is growing month after month after month. So what you said there that really caught my attention, that I really liked, because in my mind I was thinking, if you guys get 1 million people paying you $24 a month, that's 24 million a month.
Right.
That's 300 million a year in residual income for a stock that's trading under $1. I want that to sink in, guys, because you said you already have 130,000 patients.
Right.
So it's not that far-fetched. And then you mentioned the 1 million customer number, which in my mind I was thinking about. So I'm happy you mentioned it, because in my mind I'm thinking, well, if their revenue grows 10x, then you could potentially see 10x price appreciation in the stock as well, guys. So think about that. And that's not a guarantee. And remember, Rich TV Live is always for education and entertainment purposes. Always do your due diligence. Always do your research before you invest in anything we discuss here in our show. And speak to your financial advisor. Chances are your financial advisor is going to say, yeah, that's a great company. You should invest. My next question is about some of your news. So we talked about Skylight yesterday, and the stock was at 68 cents. Today it's sitting over 80, and our members are already up. Members are winning. Members are excited. You had some really big news yesterday and today, which I want to touch on. First of all, you are now on the OTCQX in America. Congratulations.
Thank you.
And you just launched Tennessee, your 15th state in America. So can you touch base on those two pieces of news? And congratulations on all the news.
Oh, thanks. So graduation certainly is always a nice thing. Look, at the end of the day, the QX, I think it validates who we are as a growing business, where we started, where we've come from, where we're going. It presents our shareholders a far broader market and greater liquidity with, billion-dollar companies trading on the QX. And so, we really are, we're happy now that we're on an exchange in the US that really symbolizes where we want to go and where we believe our business is growing and as we execute against it. In terms of the acquisition, this just falls right into the thesis of our acquisition model. And this is actually our 4th announcement this year so far. So we've announced 3 deals prior to this. We closed a transaction in Texas, closed a transaction in Washington. We announced an LOI set to close at the end of December, actually just a couple of days into January, in Colorado, and now with the end of this year with Tennessee. And so we're very active, and we've got over $10 million of cash in the bank. The beauty of these transactions is they're so attractively priced, and if you think about where our stock trades at today, what we're buying these companies for, there's immediate accretion. I mean, we paid less than half times revenue for Tennessee, but what it brings to us is 2.2 million in revenue, 400,000 in EBITDA. All these acquisitions are immediately accretive revenue-wise. They go direct to the contribution on the profitable side, which means we're already profitable now. We continue to get more profitable with each acquisition. And as we continue to unmask more deals in the US, we're sitting at about $50 million in pipeline opportunities right now. And that's just growing month on month on month. And there really aren't any strong consolidators in the US doing what we're doing, especially within this primary care market. So we really are excited for continuing to execute on this platform, announce more news flow. And again, it's one of the pillars for growth for us, and it's certainly, you know, working very well.
Now, you mentioned that there isn't any main competitors. Are there any main competitors? And if so, what sets you apart from them?
70% of the US healthcare market is fragmented, right? Which means that most of these doctors operate independently. Because this, and for anyone that's aware of healthcare in the US, the administrative burdens on clinics are phenomenal. I mean, you've got multi-payer systems, insurance companies by the hundreds, and it's tough for single doctors to have to, you know, keep up with all of this. So what's happening is there's this natural consolidation now where large health networks, legacy players like Kaiser or Optum, or, you know, some of the larger well-known names are buying these clinics. So in most of the circumstances, when we're negotiating deals in these regional areas, our largest competition comes from the local hospital networks. And as I mentioned before, those hospital networks create this environment where patient care is almost not at the forefront anymore, or let's call it patient-centric care. And so as a physician selling your practice, it may be your only option, but it's not the best option. And we've seen that now when we've presented an opportunity to be acquired by Skylight, where we maintain the existing location, we maintain the brand, we maintain the staff, we maintain that personal approach with patients. They like it. And so, you know, we're finding that differentiation to be really something that we're going to continue to build on. The other competition we'll face in larger transactions are private equity groups, and where they typically will roll up, synergize, and sell. But what's interesting now is some of the deals in our $50 million pipeline are private equity groups who have done the roll up and acquired 7-8 clinics and now turning to Skylight and saying, well, you can be my exit. And so while sometimes we compete against them to buy the one-offs, they inevitably come back in a package. So, you know, it just depends on timing. So not a lot of competition. It's been like this for many years. You know, we don't see any kind of challenge where we're going to see valuation pressure because all of a sudden 2-3 groups start doing it. This is the US market. There is a ton of deal flow, and I'd be very surprised if, you know, any competition were to step in that we would even notice them in the market, or they would notice us.
Now, the share structure is vital for myself and for our community to really wrap our heads around whether or not it's a good investment. And we've seen companies that have tight share structures explode, and we've seen companies that are very diluted implode. Can you explain your share structure and how much is held by insiders and institutions?
Yes. So, a little over 45% now is held by insiders, and I wouldn't even say institutions. I would say probably our single largest institutional shareholder. So Merida Capital, who's out of New York, private equity fund, has backed us ever since 2018, continue to finance, support through business development activities. With Merida Capital and just the insiders alone, we're at 45%. We've done a lot in the last 3 months to really strengthen our shareholder base. Within the float that's sitting out there at 55%, I'd still say a large majority of that float are loyal, long-term shareholders who've been with us since the beginning, who continue to strengthen their position with us. But we've also done a lot in institutionalizing that share base as well. And so over the last few months, working with some of the banks in Canada, bringing on some new institutions onto the story who have supported further rounds as well. But also these also expanded into the opportunity for research coverage now as well. And so we now have Mackie and analyst research covering our stock. We expect to have a couple more by the end of this year. And so again, I think as we continue to build, even within the 55% float, we still are very, very tightly held with, you know, with loyal shareholders. As management and insiders, we have not sold a single share to date, nor do we plan to. This is we have a long runway here, and, you know, we really believe in where this story is going to go, and we're just going to keep executing until we get there.
You guys, your price is already up 10x. Like over the last
Right.
little while, the stock was at 6 cents. Today
Right.
we see it at 80+ cents. What's your growth strategy from here?
I still think we're tremendously undervalued compared to where we are. I mean, the company today is probably at a $20 million exit run rate for 2020. We're trading at probably but little over 5 times 2020 exit run rate. When we look at 2021, you know, we've gone 50% growth in revenue between 2019 and 2020. We'll see 100% growth next year, and we're going to consistently keep adding to that growth model just because we are validating our thesis as we continue to execute. So again, I think the median trade right now, I'd say somewhere between, call it 12 to 15 times. So when you look at that gap, we still have more to go just based on our own value today. But when we start to add that level of growth onto our business, and we're playing, like I said, we're not playing in $1 billion industry, we're playing in $1 trillion industry. It's US healthcare. This is a destination for most companies. We're going to keep executing, and I expect, you know, our revenues to multiply dramatically as we continue to keep building organic and acquisition-based growth. And I think that'll reflect very well in shareholder value.
If there was one thing that you would want shareholders to know about Skylight Health, we've got about 50 people watching right now while we're live. So many questions. I'm not going to be able to get through the questions today, but if there was one thing, and we got shareholders that are owning the stock, that have bought the stock today or yesterday, that are excited about the company, what do you want them to know?
We're just getting started. And if you're on for the ride, stay here for the ride, because look, we have a profitable base of operations. We have no debt. We have over $10 million of cash on hand. We have acquisition targets over $50 million in revenue potential that's structured equitably to be able to use cash in the best way possible. And you know, we're already showing tremendous growth from a revenue perspective and adding EBITDA on top of that. Plus, as a management team, this is a try, tested, and true model. And we're here, and we're just going to deploy the same recipe back into this $1 trillion US healthcare market. So, you know, we're so excited ourselves, and you know, if you're on for the ride now, you know, I hope you stay, because it's going to go.
And what is the best way for shareholders or someone that wants to do a joint venture, LOIs, partnerships, funders to get in contact with you, Prad?
So easiest way, well, you can always go to the website, which is skylighthealthgroup.com. Or you can just email us at investors@skylighthealthgroup.com, and we will always get back to you.
Well, I'm super excited about this company, guys. Guys, if you haven't, please subscribe, hit the like button, and share this video everywhere. I believe that this is going to be one of our top picks. I'm already saying this. I believe this will be one of our top picks for 2021. I think the writing's already on the wall. You got 50 million in business in the pipeline, like you said, a subscription model that's growing. You're acquiring new states and new business opportunities every day in a growing sector in the middle of a global pandemic in telemedicine, health, which is the #1 topic in everybody's minds right now. So you're in the right place at the right time. So are all the shareholders that are watching. Thank you so much for your time today, Prad. Keep up all the great work. Prad Sekar, the CEO of Skylight Health Group, SHG in Canada, CBIIF in America. If you're not winning, you're not watching. We bring in the winners, and we bring them to you first. Thank you guys for watching. Thank you, Brad. Have yourself a great day, and continue all your great work, my friend.
Absolutely. Have a great day. Thank you so much.
Thank you so much. Thank you guys for watching. We'll talk to you guys soon.